Need to global solutions. Well, our next guest, Gregory Roxon, has done just that. He aims to revolutionize the prescription drugs industry in Africa.
When we started mPharma, we tried to answer three main questions. The first question was, what if each community in Africa had a pharmacy that was always well stocked? What if patients that went into those pharmacies had the best customer experience? And what if these pharmacies could become primary healthcare providers? When we look at the medicine supply chain on the continent, it is highly fragmented. We don't own our own pharmacies. We take existing pharmacies, improve them, put in place better technology, and then use that to increase access to patients.
And the drugs? How do you get the drugs in, and how do you manage your drug supply chain?
We built our own physical supply chain infrastructure, but it starts off from being able to actually aggregate demand across all these fragmented mom and pop pharmacies. And by aggregating demand, it allows us to become a single buyer. So we then take the volumes that we aggregate and then negotiate on behalf of all the pharmacies in our network.
What's an example that you would give us to explain how you've worked effectively?
Let's take a country like Nigeria. For 2 years, we've been working on how can we create a breast cancer treatment program. So one of the key things that we built in our breast cancer treatment program was to say, how do you actually innovate around medicine payments? We worked with Roche, the world's leading oncology pharmaceutical company, to build a payment program in Nigeria whereby any woman diagnosed with breast cancer can enroll in this program and they get an interest-free payment plan. And what we've done is that we've actually cut by half the cost of breast cancer treatment in Nigeria today.
Tell me about what you're doing in Zimbabwe.
We actually went into Zimbabwe through a partnership with the Red Cross to help the Red Cross manage the drug supply chain in the country. And one of the beautiful things about what happened is that not only were we able to increase fulfillment rates to above 90% in the Red Cross pharmacies, we also were able to bring down the cost. That today I'm proud to say that if any pharmacy in Harare doesn't have a drug, when you walk into the Red Cross pharmacy, you always have the medicines available.
What's your goal in terms of impacting people's lives on the continent?
So since 2017, we've served over 1 million patients on the continent. Each month we serve over 100,000 patients through our network of over 400 pharmacies spread across Ghana, Nigeria, Kenya, Zambia, and Zimbabwe. For me, success is when every African patient that needs a medication is able to walk into any of our pharmacies, and irrespective of how much money they have in their pocket, we can dispense a drug to them.
So what's your vision then, in terms of the grand dream that you have in your head?
I want mPharma to represent the promise of health progress on the continent, right? I want us to become a single entity that can take care of all your healthcare needs.
Thanks for joining us on our first episode of Innovate Africa. You can connect with us on our social channels and find out more on our website. In New York, at the United Nations, I'm Robin Kerno.